Hello, my name is Jenna Strisver, and my project is on the correlation between low birth weight and cognitive delay in adolescence. So many of the children in our world are born extremely premature and extremely low birth weight. My dream is to become a NICU nurse, so these will be the little lives that I get the pleasure of saving. And I wanted to understand this topic better so I get to understand what their lives will look like after they graduate from the NICU. I also have a personal tie to this. Both me and my sister were born premature. Thankfully, we weren't extremely low birth weight, but we were premature, and so it was kind of important to me to understand this topic. So just a little bit of background on what adolescent cognitive delay is. Cognitive delay is the children's thinking and reasoning, the delay is when it's below the expected average for their age. These things can include, but they're not limited to, things like autism spectrum disorder, attention deficit hyperactivity disorder, which is ADHD, and dyslexia. Um, Developmental delays affect about 15% of children, and about 1 to 1.5% of those are specific, like cognitive delays, which is what we're talking about in this presentation. Some causes of cognitive delays are alcohol and drug use during pregnancy, premature or low birth weight, meningitis, and shaken baby syndrome. So, as you can see, some of these can be prevented, but some of them are also unpreventable, and they just have to be treated after birth. So then what is low birth weight? According to the Cleveland Clinic, low birth weight is a baby born weighing less than 5 pounds, 8 ounces. Um, there also are tiers of low birth weight, so that can include low birth weight, which is 5 pounds, 8 ounces, very low birth weight, which is 3 pounds and 5 ounces, extremely low birth weight, which is 2 pounds and 3 ounces. Um, the there are different factors that can affect this. So chronic illness during pregnancy, substance abuse, preterm labor, being pregnant with multiple children, those can all affect low birth weight. Low birth weight can cause children to have issues with things like feeding, weight gain, and fighting infections. So the first study I did was conducted in Victoria, Austria, and it was conducted on children at 2 years of age. They were born extremely premature or extremely low birth weight, and it measured their cognitive delay. It found that about 50% of children born extremely low birth weight or extremely premature had poorer social competence, and overall, the children in extremely premature and extremely low birth weight groups performed much poorer than those of the children in the control group. So in this study, there's evidence to show that being born extremely preterm or extremely low birth weight caused cognitive delay, and that early intervention for these children can improve the treatment of cognitive and neurodevelopmental delays. So this study really taught me that the younger you diagnose a child, the better their life outlook will be. So, a lot of studies weren't done until children were getting older, and that's how their parents were noticing. But monitoring these children that were born extremely premature or extremely low birth weight led to better outcomes for them because they were able to be immersed in therapy a lot earlier in life. The second study I focused on was children with congenital abnormalities that were born low birth weight compared to healthy children. Congenital abnormalities are things that can affect the appearance and function of the child, and those can be based on genetic factors, environmental influences, or a combination of both, just depending on what they are. They can be life-threatening, but that was not specified in this test. The test measured height, weight, head circumference, and that compared them to the Bayley scales of toddler and infant development, as well as the Korean developmental screening test for children. It found that overall, children with congenital abnormalities have lower APGAR scores, and children born with very low birth weight are shown to have growth restriction, reduced motor function, neurodevelopmental delays, and impairment. So, in conclusion, these children that were born low birth weight with the combination of the congenital abnormalities, it can cause other neurodevelopmental delays and disabilities. So, in conclusion, what all this means when we tie it together, it's been shown that premature birth and low birth weight can affect neurodevelopment in children. There are precautions that can be taken, like ensuring that you don't use drugs or alcohol during pregnancy, trying your best to avoid those dangers. But it can also happen with no cause at all. So, take those precautions, but also, there's things that can't be done. Um, I also found that early diagnosis and testing is really helpful for these children with helping them get the proper treatment they need and the help that they need to have a more successful and fuller life. These children aren't odd. They're not children that shouldn't be paid attention to. They just need a little bit of extra help. And so that's what this early testing can do. Um, and then there are many therapies out there to assist children with neurodevelopmental and socio-emotional delays, which can be very beneficial to them and really have them lead very what we would call normal lives. So it's very beneficial to these children. These are my references. Thank you so much for listening to my presentation about the influence of being born extremely premature and extremely low birth weight on cognitive delay and neurodevelopment in children. These are my references. Have a great day.